Good. So I'm here at the moment with Amice Sellerfischbach from Karlsruhe in Germany. And Ami's run a few things on our platform, eHealth Learning, but also has been to England to run his course around the relationship between Bowen technique and Meridians. And he's going to be coming back in September, on the 19th and 20th of September, to run a course specifically around Meridians, Bowen, and scars, which I've also been on a couple of times with him before. And it's really, really amazingly interesting and useful information for Bowen practitioners. And the course is being held in Sherborne, which is in Dorset. It's a couple of hours from London, west of London. And Sherborne's actually a very, very beautiful town. If you haven't been there before, it's got an abbey, a beautiful abbey, and actually you've got two castles, believe it or not. One was is called the Old Castle, and then the New Castle, which is dating from the 16th century, was built by Walter Raleigh, he who brought the potato and tobacco, I think, to England, and then I think got executed at the end of his life as a result. But anyway, it's a beautiful place. There's lots of places to stay, lots of nice places to eat, and lots of walking country around if you want to make a bit of a holiday out of it. So this course is open to people who've done work with Amiche before or not, or if this is your first time and you want to explore this whole topic of the relationship between Meridians and Bowen. It's a really fascinating topic. So welcome, Emmy. How are you doing today?
Thank you. I'm doing very well, enjoying the springtime here in Germany. Everything
Yeah.
is blossoming and it's extremely beautiful. So
Yeah,
it's a
it's
very
beautiful
nice
here as well. Yeah.
season of the year.
Yeah.
Thank you for inviting me.
Yeah. So we said that I said that this course is suitable for people who've never worked with you before or perhaps don't know anything about Chinese medicine or acupuncture, because I know you're an acupuncturist, you're a Bowen practitioner as well. So do they have to know any background knowledge, really?
I'm going to repeat a lot during the course, meridian pathways in relationship to scars. So I think that everybody's invited. Also, people that have done the courses with me, but also new people because I'm going to cover, so to say, from scratch the meridian pathways, and I will demonstrate how meridians can be blocked through scar tissues, and therefore everybody's invited.
Hmm. And can you say why this topic is so important? Like, how do scar tissues affect us? I mean, I've got a few scars, and I know it affects me on a kind of fascial level, but other deeper things that it affects, like organs or, mobility issues, things like this.
Yeah, I think all therapists can just agree with me that we see scars every day on a regular basis. And scar tissue is not the original tissue, so it's always a blockage for the tissue, for the fascia, but also it blocks the flow of chi, of energy in and within meridians. So I treat scars on a regular basis and a lot, and the relief is huge. Yeah,
Hmm.
if you're treating it regularly, then you can have very, very impressive results at your clinics.
Yeah. Can you give me an example? For example, I mean, a lot of women have cesarean section scars, don't they?
Yeah,
What kind of things might that affect if it's not worked with, would you
yeah,
say? Because I know you'll be talking about that on the course, won't you?
yeah. It's a very, very good example because I don't know how it is in England, but in Germany it became like, so to say, very modern to do C-section.
Yeah.
So they would just do C-section without waiting or allowing the doula to work with a pregnant woman a little bit 10 more minutes longer,
Yeah.
maybe to get it in a natural way. So I observe many, many C-scars at my clinic, and it's mostly young women that have huge scar. And for an example, last week I've treated a lady. She came to me. It was the second cesarean scar,
Mm.
and she told me I feel at the area nothing. She told me you can put hot oil on it or ice, and there is no sensation.
Yeah.
and she has a lot of pain. And since she got the C scar, her menstruation is irregular and very, very painful. And also, having sex with her husband became a nightmare because she has a lot of pain during the sex. So it's not only the surface which is involved,
Mm.
it's also the depth of the scar tissue and also the blockage of meridians. And there are many meridians flowing in this area. For example, the stomach, and for example, the spleen, liver, also the conception vessel, the renmai, so to say, in Chinese medicine.
Mm.
And it's very, very I think important to treat the scar so the flow of qi in these meridians is just replenished, and therefore it can be released, all the pain and her problems or
Mm.
the problems in this area. But we also observe something very, very interesting. I have many women with thyroid problems years after getting a cesarean scar. And this is often because the flow of qi in the conception vessel, the renmai, which flows until here,
Mm.
is blocked through the scar tissue. And if we treat the scar, then we release the, so to say, lack of qi in
Mm.
this area, and then the flow of qi can be much better after treating the scar.
Mm. Yeah, I mean, it's a very high percentage here, certainly in the UK, of women who have C-sections. It's nearly almost up to 50% now. It's
Yeah, which
incredible.
is huge.
Yeah, it's huge.
Yeah,
And you'll be talking about working with different types of scar tissue, won't you? Like, for example, maybe burns or different kinds of operations,
yeah,
those kind of things, and how to work with them, right?
yeah. A big topic because most of the operations nowadays are being made laparoscopic.
Yeah.
So on the surface, we just see just little scars, button scars, so to say, which we'll learn how to treat. But the whole wounded area in the stomach is scarred, so to say. So the pathways of the instruments in the abdomen
Yeah.
are still there. So we will learn how to palpate it. I call it like virtual scars because we don't really see them. And I will teach how to paint the flow of the scar on the surface and then how to treat it.
Hmm.
Also, the treatment of the scars, we learn how to do it in two levels. One, very much on the surface,
Hmm.
and the second flow, much deeper.
Hmm.
So we are approaching first the scar on the surface, and then going deeper into the fascia, into the tissue, and releasing the tensity of the scar also in deeper areas.
Hmm. And you've seen, presumably, I mean, you've mentioned one case study there, but you've seen like pretty major transformations as a result of this work in your clinic, have you?
Yeah.
Yeah.
For an example, I have a patient, she used to be an opera singer.
Mm.
So she used to be on stages, and she's a very proud woman. So her appearance is very, very impressive.
Mm.
And she got a mastectomy on both sides. And she's, I think, 92 this
Wow.
year. She'll turn 92. And she got it, I think, 10 years ago, something like this. And she didn't want to reconstruct the breasts. So she didn't get any implants or something. And her thing with the operation is she would buy the most expensive scarves in
Yeah.
shops, and she's very, very proud, and her appearance is very beautiful. But she told me when she first came to me, I'm just shrunk. I'm shrunk in the breast. I cannot get here. I cannot be like this proud woman, this singer
Mm.
that opens her chest, and I'm just shrinking and shrinking.
Mm.
And she had also a severe pain in the neck, in the shoulders, because of this like getting shrinking through the scars.
Yeah.
And I started to treat her scars regularly. So usually I like to have a session between 5 to 6 treatments every week, and then we can reduce
Mm.
the amount of treatments. The thing with scars is also very interesting. After treating, they're getting released, but scars are getting like rescarred every single time during the year because our tissue is being renewed, our
Mm.
skin.
Mm.
So, especially in autumn or spring, many patients of mine who have old scars, which I've also already treated, they will come again or would come again to retreat the scars because scars are getting always like shrunk again.
Mm.
And after treating her, she told me, "Oh, I can finally breathe. I can finally be this proud woman and be like straight in the spine and
Oh,
like reuse my lungs again as I used to."
that's amazing, isn't it?
It's
And
very
what?
amazing. And also her doctor who operated her breast, he
Yeah.
asked her, "What have you done? Who treated the scars?" Because usually in Germany, and I learned it as well. I did before neural therapy. So you inject into the scars lidocaine or procaine,
Mm.
and it's very, very painful and it's very, very stressful. Also for me, because my patients, they were like, "Oh my God, this is really, really painful."
Yeah.
And this is why I started to play with Bowen moves on scars. And I thought, wow, this is so efficient and this is
Mm.
so stressless
Mm.
in comparison to these injections I used to do. And therefore, I'm using it on a daily basis.
Mm. And will you be teaching a little bit of self-help, like what we can tell our clients how they can work with, I don't know, can they use oils or massage themselves? Do you talk a little bit about that as well?
Yes, definitely. But I do wish and want that our clients will come again to our clinics.
Mm.
So the homework I'm giving is not how to treat the scar like we do, and we will. So like remedies with creams or oil or the beautiful oil Bowen is very
Oh
very
yeah.
good also for scars. Um, I think everybody knows Bowen is from Helen
Yeah,
Perkins.
Portuguese.
Yeah.
Yeah, 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 yeah. Yeah, cool. Good. Alrighty. So, yes. I mean, what's your wish for people who come on this course? What do you want them to go away with, um, knowing and being able to practice?
Um, Actually, come open, and I know, and I guess you can tell also the people you've been to my courses. There's a lot of material, a
There
lot
is.
of
Yeah.
Chinese medicine and meridian pathways and points. So just be open
Mm.
and don't come with the expectation after this weekend I'm a therapist of TCM or a specialist in Meridians
Mm.
because it's a lifetime job. So
Mm.
you always have to repeat and I do wish that people will get my scripts, my books,
Mm.
and I will show how to go back to the script, go back to the book, and just discover it again in the clinic with your patients. So
Mm.
just come open and open minded, and I hope that the participants also have scars. And maybe
Yours
it would
does.
be a nice idea that you will get some of your patients with interesting scars
Mm.
to come to Sherburne, maybe to the second day, then we can treat and I can demonstrate.
Mm. I probably have some we can find.
Yeah,
Sure. Yeah. Yes, and I meant to say that the course comes with a really fantastic handout with lots of diagrams, which are very useful then to relate
yeah.
the meridians to Bowen moves and things like that. Very useful. Great. All right. Well, we're looking forward to seeing you,
I
Bernard.
look forward to come to the Abbey. I'm a big fan of Downton Abbey, so
Oh, well, no, it's not. No, Downton Abbey is like an old house. I mean, it's
yeah.
like, the Abbey is like a well, like a mini cathedral, but it's very beautiful. Yes, it's very
Oh,
beautiful. There are lots of old houses around there you can visit, a bit like Downton Abbey, if you
oh,
like that
that's
kind of
beautiful. Maybe we should
thing.
have a dress code for the course. They all come like in historical costumes.
Yeah, so
I
the
will
course is
bring my
being held
wallet
actually
with.
very near the Abbey in a lovely venue. So it's on the 19th and 20th of September, which is a weekend, Saturday, Sunday. And you can get details from my website. You can book through there, which is you can search for my name, John Wilkes, Wilks, or the website is therapy and then a hyphen training.com. That's therapy hyphen training.com. And if you go to courses, you can see all the details there. Thanks
I
so
will
much,
try
Amy.
maybe to publish a few photos. Um, in the beginning of May, I'm going to teach this workshop in Reykjavik, in
Oh,
Iceland.
fantastic.
So I will try to make photos and maybe post it over Facebook that people get a little
Yeah,
bit of idea how it looks like treating
yeah,
scars.
wonderful.
But I do want to emphasize the technique is not that complicated. So if you're coming to the weekend in September, you can just treat your clients on the first Monday after the workshop. So it's
Yeah, the
very,
technique is not difficult, is it? It's the
yeah,
understanding behind it, which is
exactly,
more
exactly.
detailed. Great. Thank you so much. I mean, thank you.
Thank you, John, for having me.
Thank you.